the topic of my talk is impact of lifestyle on health. The objectives of my talk is twofold. The first part will be to create an awareness about lifestyle diseases. What are the lifestyle diseases? What are the complications? The second part of the talk would be what constitutes a healthy lifestyle. Poor lifestyle choices result in lifestyle diseases. It's as simple as that. Good lifestyle choices bring out health, and just like this picture, if whatever you put in is bad lifestyle, like unhealthy eating or physical inactivity, stress, yes, stress does count. It produces the lifestyle disease. The main lifestyle diseases are cardiovascular disease, the respiratory diseases like asthma and chronic, the COPD or airway diseases as we call it, cancer, diabetes, high cholesterol, high blood pressure. So I'll go through some of them and give you an awareness of what they are. So the risk factors for all the lifestyle diseases, there are non-modifiable, which is you can't do anything about it. That would be your genetics. Then there's modifiable. They are obesity, sedentary lifestyle, tobacco use, uncontrolled diabetes, chronic stress. All these are modifiable. That means that those are the ones that you can do something about, which is a good thing. So hypertension, which is otherwise called high blood pressure, is one of the most common lifestyle disease. So what is it? It is systolic blood pressure greater than 130 and diastolic blood pressure more than 80. So, and what is it essentially? So you see the blood vessels. The first part of it is the normal blood vessel. The second part is the blood vessel which has thickened walls. So as you know, when blood flows through a smaller area, it creates pressure. That's called blood pressure. So more numbers. The blood pressure categories as given by American Heart Association, you'll see normal is 120 systolic and 80 diastolic. Elevated, that is, we're not yet in the hypertensive range, would be 120 to 129 and less than 80 diastolic. High blood pressure, which is called stage 1, would be 130 to 139 and 80 to 89 diastolic. High blood pressure, that's stage 2, is 140 or higher or 90 or higher on the diastolic range. Hypertensive crisis, yes, you really need to get to your hospital as soon as possible, is when it's greater than 180 and when the diastolic is higher than 120. So why is this hypertension such an important or deadly disease? It's because of the complication essentially. So when the blood flows at a high pressure to all your organs, for example, to your brain, it causes stroke. To your heart, it causes heart failure. To your eyes, it causes essentially blindness at a later stage. We call it retinopathy because the retina is damaged. When it causes your kidneys, it causes renal failure. When it flows to the lower extremities or the blood vessels to your legs, it definitely causes damage to the muscles. So how do we treat high blood pressure? Stage 1 in patients with lower cardiac rhythm, that is when 130 to 139 and diastolic 80 to 89. In patients with low cardiac risk, you can treat with lifestyle modifications. I'll talk about what they are in a later moment. And you try it for 3 to 6 months. If it works, great, you continue that. If it doesn't, then you need medications. Stage 2 hypertension, or that is when it's beyond 140 by 90, that's when you would want to give, and you have a high risk of heart disease. That's when you want to start medications in addition to lifestyle diseases. Yes, medication alone doesn't count. Lifestyle modification is a must. And the goals, yes, we do have targets, we do have goals, 130 over 80. So what are the lifestyle modifications? How should you change your lifestyle? DASH diet. It's not something that the diet you grab and go, although it sounds like that. DASH diet is essentially dietary approaches to stop hypertension diet. I'll explain a little more about it later. Essentially, it's a diet with more of whole grains, more of proteins, and less of salt and less of alcohol and less of smoke. So that is what is called a DASH diet. Weight loss has a huge benefit. Actually, systolic blood pressure goes down by 5 millimeters of mercury. You might think that's a small number. It's not a small number if the blood pressure goes down by 5 millimeters of mercury, because even that helps with the organ damage. It prevents organ damage. Exercise 150 minutes per week. So that means 30 minutes, 5 days a week. That's all you need to do. You have a lifestyle modification. Moderation use of alcohol, reduce sodium intake. This is probably one of the most important things. Sodium intake. What is that 1500 milligrams per day? That would be half a teaspoon of salt. This is only applicable to hypertension patients. Studies have shown that people who are normotensive or people who have normal blood pressure, it's probably not that effective or maybe even harmful. It is controversial. Studies are, the recent studies are showing that maybe less salt is also a bad thing for normal pressure patients. But for when you're hypertensive, yes, this is a must. Increase intake of potassium-rich food. Potassium, what it does, it causes the sodium levels in the blood, or the sensitivity of body to sodium, it decreases it, which is a good thing in hypertension. So that's why potassium-rich food like tomato, orange, banana, spinach helps. Reduce chronic stress, very important. Smoking cessation, and some medications like ibuprofen. The decongestants, the ones that you use for allergies, some of them can cause your blood pressure to rise. So if you're hypertensive, you want to avoid that. High cholesterol levels. So what is it? It's essentially that's the second lifestyle disease that I'm going to talk about. So if you see, this is a normal blood vessel. When cholesterol levels, that is the lipids, fats, increase in your blood, it causes something we call a plaque underneath the blood vessel. What happens is it causes the blood flow to be very slow, and later it causes a blood to clot and later problems. So complications to it, essentially cardiovascular disease. So the first one is, so when this plaque forms in the brain, the vessels to the brain, that's the main reason why you have strokes. When it blocks to the heart, it causes heart attacks. Essentially what happens is blood flow stops to the heart, the muscles in the blood, they don't have any oxygen coming in, and you get a heart attack. And you have the peripheral vascular disease. That is when the muscles in the leg get damaged because of decreased blood flow. So how do we treat high cholesterol? Healthy diet, exercise, smoking cessation, weight loss, medications. These are the things you can do to treat high cholesterol levels. The important thing would be diet. Yes, a low-fat diet would help with decreasing cholesterol levels. And weight loss, I can't stress on how much weight loss would help with decreasing the cholesterol levels. Medications, yes, they do have a huge benefit, and definitely consult your doctor if you have high cholesterol levels. Diabetes, this is something I'm very passionate about. It's a metabolic disease. Essentially, insulin, that is the enzyme involved in diabetes. So when you have an insulin deficiency, and when the pancreas, that's an organ in your abdomen, that stops secreting insulin. Or the second part of it is that it might be secreting insulin, but your cells are very resistant to intake or resistant to insulin. When that happens, what happens as a result is high blood sugar levels. So essentially, your body is not able to metabolize carbohydrates, and you have high blood pressure. The symptoms would be feeling tired, frequent urination, weight loss, feeling hungry all the time, blurry vision, thirsty all the time, numbness and tingling. So, and of course, wounds that don't heal. So how do we diagnose? So essentially, there are 3 tests. 2 tests are important, taken probably a week apart at different times. It's important to make this diagnosis. We don't usually go by one test. So hemoglobin A1C, this is a blood test, And when that number is a percentage, if it's greater than 6.5, yes, you are diagnosed with diabetes. I would repeat the same test maybe or a different test after a week just to make sure that that was not a lab error. There is a second group which I call pre-diabetes. Pre-diabetes does not mean that you have diabetes. It just means that you have an increased risk for diabetes. People with pre-diabetes, if you're diagnosed now, in 5 years or 4 years or 5 years, you do have a risk of developing diabetes. So that is exactly an early warning sign. The second test is fasting blood glucose. You would know, you would usually see it on your lab test. When that is greater than 126, yes, you do have diabetes. The pre-diabetes range is 100 to 125. The third test, it's not usually done. It's more important for patients who are pregnant, in whom we do it. And in that, it's greater than 200 is the warning sign, and 140 to 199 we call it pre-diabetes. So why is diabetes a really serious problem? The issue with diabetes is when you have blood sugars high, probably you won't feel that bad. But the problem is the effect it has on the organs. For example, retina. Diabetic retinopathy is the leading cause of blindness in adults. Stroke, you have a 2 to 4-fold increase in stroke. Cardiovascular disease, that is the heart disease, you have 8 out of 10 diabetic patients, they die of a heart disease. Diabetic nephropathy, that's the kidney disease, where later stage, if you're not taking good care of your diabetes, then you might end up on dialysis, or even maybe you might need a kidney transplant, because diabetes can very affect your kidney. And diabetic neuropathy, that's when your nerves get affected, you get the numbness, the tingling, and definitely a lot of pain also, which is really affecting the quality of life, is also a serious consequence of diabetes. So how do we treat diabetes? So I think the first and foremost important thing is that yes, you do have to follow up with a specialist. You need someone to coach you, to train you, and to motivate you throughout this process. Denial is not something I would advise. You have to recognize that yes, you do have a disease. But is it the dead end? No, it isn't. It's actually, I've had a lot of patients who do extremely well with diabetes, who live for years and years because they just take good control of their blood sugar levels. Medical nutrition therapy, I won't call it healthy diet like I would call on the other hypertensive or high cholesterol levels, because it is a little more intricate nutrition therapy where you have to probably keep an eye on your carbohydrates, where you have to keep an eye on your insulin levels and all that. So the doses of insulin. So you would need a dietitian and your doctor to work together to personalize your diet and help you. Exercise, again, 150 minutes a week. 150 is the golden number. Smoking cessation, medications. Once you have diabetes, there are umpteen number of medications that can help you. Some of them are beneficial to some people. We have actually 10 oral medications which can help you. We use only 3. Like 3 in each patient. You don't go more than 3 oral medication for a patient because it's been found that it's not beneficial. So we mix and match, and we essentially choose which medication would work for a certain patient. And insulin therapy. So what I've usually found is people just want to get oral medication and they don't want to go on insulin. It's as if that insulin means, yes, you are on your deathbed. No, it's not. Insulin is not something to scare you. It's actually really what benefits. I won't advise to start insulin more earlier than you need to, but if at a point where if you need insulin, yes, you should go ahead and take insulin as per your doctor's prescriptions. You won't want to play anymore with your oral medications if they are not beneficial. Obesity or overweight. So essentially it's excessive fat accumulation that might impair health. Body mass index, again, we have formulas, weight by height squared. And these are the terminologies that we use to diagnose obesity. BMI less than 18.5 is underweight. BMI 18.5 to 24.99, healthy weight. 25 to 29.99, overweight. And 30 or more is obese. Another index that we use to help assess obesity is waist circumference. So this is how this is measured. So you measure your circumference around your belly button or your navel, and these are the golden numbers. For men, if you're greater than 90 centimeters or 35 inches, yes, you're at high risk. Greater than 80 centimeters, 31.5 inches, yes, you're high risk. The numbers are different from the Americans, so each ethnicity has different numbers. So these are numbers for Indians. So what you need to, mostly in the Indians, the BMI in some individuals can be normal. It will be the waist circumference that would be a problem. So you have to keep a close monitoring on your waist circumference. So what are the complications of overweight or obesity? The ones I would, lung disease, pulmonary lung disease, obstructive sleep apnea. So what happens here is when you're overweight, when you lie down, your tissues of your neck, they kind of close down your airways. So when at night you're sleeping, your oxygen levels are cut off. You won't know, by the way. And carbon dioxide levels go up. And your heart would feel like it's going on a treadmill, despite the fact that you're sleeping. And then in between, you might wake up, or your airways just figure it out by themselves. But this keeps happening multiple times during the day. And you can have hypertension can be a cause by this obstructive sleep apnea. Your cholesterol levels can go high, can cause you to have weight gain. And so this is one of the most important consequences of obesity. How do you diagnose it? Yes, you go to a sleep specialist and get sleep study. One of the symptoms would be excessive snoring. And yes, it can be treated, and I won't go further into it. Then you have an increased risk of stroke, you have an increased risk of heart disease, you have an increased risk of cancers. Yes, obesity causes a couple of, probably 10 to 12 cancers, and breast cancer, esophagus, pancreas, kidney, prostate. Yes, when you're obese, you have a high risk. Osteoarthritis. And also fatty liver is another cause because when the fat gets collected in the liver, it causes the liver to function, to be dysfunctional. So how do we treat? A moderate weight loss of 5 to 10% of body weight has significant effects on blood sugar, on blood pressure. So even if you're 60, if you come down to 50 kilograms, yes, that would have a benefit. Again, exercise, healthy way, a healthy diet, medications. You do have medications, gastric bypass surgery, all these are options. Daily, so one of the things I would want to stress is one of us has a daily calorie requirement. Men, it's 2,500, that's active women, 2,500 kilocalories. Most women, sedentary men, 2,000 calories, and sedentary women, 1,500 kilocalories. And once you estimate that, you subtract 500 calories to have a weight loss. So whatever you take in as food plus exercise, you will need to have to at least have a 500 kilocalories deficit to lose like around 1 pound of weight per week. And if you have 1,000 calories approximately deficit, you will probably lose 2 pounds a week. 1 pound a week is good enough, I would say. So don't expect your weight to decrease in like a week. It never happens. Even if they prescribe pills, that doesn't happen. It is a very slow process, so be patient. Chronic lung diseases, again, due to smoking, your airways get deposited with the smoke particles. Nicotine have a direct toxic effect, and you get airway diseases, which is another lifestyle disease, which can be modified. So what is a healthy diet? So essentially, when I talk about healthy lifestyle, these are 2 things that comes to your mind. Yes, I can eat only 2 cucumbers and 1 orange. I should starve the whole day, or yeah, I should exercise like Arnold Schwarzenegger. This is a healthy lifestyle. No, these are misconceptions. So healthy diet, essentially, this is what we are talking about. There are probably two diets. That is the Mediterranean diet. Studies have shown that it has that can cause decreased risk of cardiovascular disease. And the DASH diet has also been shown to be beneficial to decrease cardiovascular disease. So, but other than that, for weight loss, no specific diet has been found to be good or bad. Essentially, for weight loss, it would be calorie restriction. You can eat what you like, but just count your calories. For decreasing cardiovascular disease, this is the DASH diet that I have been talking about. So your base would be bread, cereal, and essentially it would be whole grains. I will talk about what a whole grain is. Your fruit groups, 2 to 4 servings a day. Vegetable groups, very essential. Once you go up, the percentage in your diet would decrease. The milk yogurt group would be less. The meat, poultry, fish, again 2 to 3 servings a day would be okay. Fats and oils, use very sparingly. So the dietary guidelines, I would say we are now at the crossroads. Dietary guidelines have always kind of remained the same, but recently there are a lot of controversies. But right as of now, this is what looks like what works, at least for now. A variety of vegetables. So studies have shown that vegetables cause no harm, and they in fact are really good. Dark green, red, orange, legumes, all of it, they are good. Fruits, especially whole fruits, that's said because fruit juices, probably not. The whole fruits would have a lot of fiber, and that one would help in satiety, that you would feel more full after you eat the whole fruit rather than you have juice. And the second, the next one is grains. That's whole grain. Third, the fourth one would be fat-free or low-fat diet. Eat more protein-based food. So that would include seafood, lean meats, poultry, eggs, legumes, nuts, soy products. So another benefit of protein would be it also helps you to feel more satisfied after a meal. The problem with the earlier recommendations were, yeah, you go down on the fat, you probably a little bit of protein, but carbohydrates. The carbohydrates are okay. But the problem with carbohydrates essentially, and our diet is mostly carbohydrates, is that it is taken up fast by our system, so you feel hungry a lot more earlier, and also you tend to eat a lot more portion size than if you would eat a protein. So this no limits now, the latest guidelines, they don't have any limits on cholesterol, the dietary cholesterol. Earlier they used to say 300 milligram per day. The latest one says that the dietary cholesterol, you don't have a limit. But it doesn't mean that you can take the cholesterol from saturated fat. The saturated fats, it's still not proven to be really good beneficial. So if it's the cholesterol, you eat the healthy cholesterol that's low in saturated fat, that would be monounsaturated and polyunsaturated fatty acid rich food. And then minimal trans fat intake. So I'll explain about the fats in a little later. Other guidelines would say consume less than 10% of calories from added sugar. That would be the extra white sugar that you add. It should amount to less than 10% of calories. Consume less than 10% of calories from saturated fat, and 1 teaspoon of salt is less than 1 teaspoon of salt. This is for normal sensitive people. So what is whole grain versus refined grain? Whole grain would mean has the bran and all the nutritive contents. Refined grain doesn't have any of that nutritive contents or the fiber part of it. So the whole grains have low glycemic index. That means that it causes less increase in blood sugar when you eat, compared to refined grain, which just pushes your blood sugar to higher rates. The high nutritive content, low nutritive content for the refined grains, and oatmeal, brown rice, millet, whole grain barley, all this whole wheat bread, all form the whole grains, and this is what you should eat more. While white rice, all the cookies, dosha, idli, they come from white rice. And white bread, white sugar, maida, all of them, they are refined. So because of high glycemic index, they usually have more. So I spoke about fats. So essentially the saturated fat would mean animal fats, poultry fats, and they tend to remain solid, and those are the bad ones. Trans fat, that's what the business, that is the restaurants, they use to fry foods and everything, because that gives a longer shelf life. That's where you really need to be careful about. This causes the cookies, sweets, all of them, they are bad. The monounsaturated would be plant-based, and the polyunsaturated would be fish and vegetables, which are good. Physical activity. So this is a pattern I found on which fits your busy schedule: exercising 1 hour a day or being there 24 hours. Sitting is injurious to health. Yes, all our chairs should have that on written on there, just like they have it on cigarette smoking packages. Because studies have shown, the recent studies have shown that who sat for more than 13 hours a day had twofold a greater risk of death compared to those people who sat less than 11 hours a day. The benefits of exercise, there are many. They improve weight loss, they promote weight loss, blood pressure, all the lifestyle diseases, they decrease, and also it improves your self-esteem, which is really good. What is the physical activity guidelines? They say 150 minutes a week of moderate intensity exercise and 75 minutes a week of vigorous intensity is essential. So this is a must, this is not an option. 150 minutes would be 30 minutes 5 days a week. An ideal duration of aerobic activity, again, it should be 10 minutes or more. You can't just do vigorous exercise for 2 minutes and say, yes, I've exercised. That doesn't work. It takes you have to do it at least bouts of 10-minute duration. Muscle strengthening exercises, they are really beneficial because of the fact that when you exercise your muscles, it improves your body balance on the whole. And when you exercise your muscles, they burn the calories at a rate even after you've stopped exercise, which is why it's more better. The aerobic exercises, when you exercise, you have the benefit. The muscle strengthening exercises, even when you're not exercising, you have the benefit. But you don't do it muscle strengthening every day because that can cause injury to your muscles. So you do it on alternate days so that your muscles get some rest time. Now, smoking. Why is smoking bad for you? Essentially because of the effects that it has. That it causes a lot of cancer, different kinds of cancer, head and neck, lung, kidney, chronic diseases, again, stroke, heart disease, and so on. Passive smoking is also injurious to health. That is when somebody else smokes and you breathe in the smoke, especially for children and adults, it has harmful effects. So what happens to you when you quit? 20 minutes, your blood pressure and heart rate really improve. 2 weeks, lung function improve. 1 year, risk of heart attack is half that of smokers. 5 years, risk of cancer is half of that of smokers. And 15 years, your risk of heart disease is equal to non-smoker. That's amazing. Avoid alcohol. Actually, dietary guidelines suggest that you're okay to have 2 drinks for males per day and 1 drink a day for females. And this would be what a drink would suggest. It doesn't mean the size of the glass, but 12 ounce of beer, 4 ounces of wine, or 1.5 ounces of meat. What more can you do? So we talked about the lifestyle diseases, about how the complications they have. We talked about diet, a healthy diet, what it should consist of. We talked about exercise, we talked about things to avoid. But what more can you do? So it's good to get screenings done at regular intervals. That would be blood pressure checks once every 2 years if your blood pressure is normal, but more frequently if you have high blood pressure. Your cholesterol level, 4 to 6 years for normal risk people, but again, more annually or maybe 6 monthly for people with high cholesterol levels. Check your BMI, waist circumference, blood glucose tests. Yes, at least 3 years if you don't have a risk, but if you have risk factors more frequently, and discuss smoking and physical activity with your physician as well. Another thing that has been a huge problem these days has been how to use social media. You get all these WhatsApp messages saying lemon juice is good, drink hot water in the morning, it's good. So always identify the source of information. If I come and talk to you about tax and stocks, you won't believe me. So the same applies. Just because you have a body doesn't mean that you know everything about it. So always you check for what's the source of information. Clarify with your family physician. Read online information from trustworthy websites like WebMD. There is one for the Keralites. It's an Info Clinic India, which is a Facebook page for the by Malayali doctors. Cancer-related would be keralacancercare.com and cancer.org. Both are very trustworthy websites. Again, summary, take control of your life. Yes. Healthy lifestyle is not just an option, it's the only option that you have. Don't live in denial, but recognize your unhealthy patterns and actively work to change them.